Welcome to Penley Warner's project for Healthcare Informatics, CGS 2146. This is a look at telehealth as a solution to socioeconomic distress in the U.S. healthcare system. The American healthcare system is in a state of crisis because healthcare dollars are not being used effectively. This chart shows just how inefficient our healthcare system is. The U.S. spent an average of $4,500 per capita for healthcare services in 2000. But received roughly the same outcome as Cuba, which spends only $186. This graph is based on statistics from the year 2000. Unfortunately, the cost of per capita spending for healthcare in America has now increased to $7,290, and that price will continue to rise until we make big changes in the way we deliver healthcare services. To decrease healthcare spending and improve access to healthcare services, we must shift the focus to preventative care, which is far more affordable than acute and long-term care. Improving access to quality care for all Americans is an enormous challenge, but it is possible. The viable, cost-effective solution to the problem lies in telehealth services. The Obama administration is currently pushing for a national broadband plan that would facilitate the delivery of healthcare services wirelessly from coast to coast. Here's Obama discussing his plans for the future of healthcare.
It's possible for businesses to deploy the next generation of high-speed wireless coverage to 98% of all Americans. This isn't about faster internet or fewer dropped calls. It's about connecting every part of America to the digital age. It's about a rural community in Iowa or Alabama where farmers and small business owners will be able to sell their products all over the world. It's about a firefighter who can download the design of a burning building onto a handheld device, a student who can take classes with a digital textbook, or a patient who can have face-to-face video chats with her doctor.
Using telehealth services, patients can monitor their heart rate, blood glucose, oxygen levels, and other vital signs from the comfort of home. Patients can live video chat with their doctors or see specialists thousands of miles away, all at a reduced cost to both the patient and to the provider. Informatics professionals will usher in this technology and help solve the crisis in our healthcare system. Let's look at a demonstration of a patient video conferencing with their healthcare provider.
Just wanted to know how you went with your elbow injury. Where's it feeling sore today?
It's still sore around here, Dr. Allen.
Right. And what about if you tilt your hand back? Does that give you more pain?
Like this?
Yeah, just pushing back as firmly as you can.
Oh yeah, that hurts.
Okay, have you had any physio today?
Yeah, I've been to the physio this morning.
Okay.
In addition to being able to video conference with your doctor without leaving your home or taking time away from work to travel and sit in a waiting room, telehealth also provides remote monitoring systems. Imagine if a truck driver had to quit his job because his chronic illness required that he stay home for regular checkups with his physician. Now the truck driver can continue working and supporting his family while receiving the care he needs by traveling with his remote monitoring system. All of this can be done at a reduced cost to both the patient and the provider. Telehealth helps providers meet their ultimate goal, providing the right care at the right time, in the right place, and at the right price. No longer must patients wait until their illness has progressed to the point that they must be admitted to the hospital at a high cost. Now patients can gain access to specialists anywhere in the country and without the additional travel expenses or lost wages. The provider saves money by freeing up the time clinicians spend doing mundane tasks like taking vital signs, so that more time can be spent managing the complexities of patient care, like analyzing data and making interventions on patients when necessary. Many Americans have been excluded from our current healthcare system because they simply can't afford this overpriced healthcare, or they can't afford to leave work to seek specialized treatment far from home. Patients who have previously been overlooked by a wasteful system can now benefit from an affordable telehealth system that empowers them to get involved in their plan of care. Telehealth allows patients to actively participate in their health, which benefits the patient by making the provider's plan of care more effective. Providing high-quality, curative, and preventative health care to all Americans may have seemed impossible in the past, but with telehealth services, better care can be provided to more people, and it can be realistically sustained by our economy. Healthcare informatics professionals now have the opportunity to implement a telehealth system that will help restore our nation's economy, allow providers to be more efficient, and give Americans the healthcare system that they deserve.